There's one segment of our population that we are losing right now. Recent study this week came out and said 1 out of every 5 4-year-olds in this country is obese. That is a ticking time bomb.
To find solutions to America's health cost crisis, the causes, or health cost drivers, have to be identified. 2 facts dominate the landscape.
It's fair to say that over 75% of the costs of healthcare in this nation are attributable to chronic disease.
Since 1985, we've had 2 events, one a doubling of obesity in the country, and 2 with it, a 60–70% increase in diabetes, hypertension, pulmonary disease, back problems, depression, you can go down the list.
How has chronic disease become such a major driver in the growth of U.S. healthcare costs? Several factors contribute. 1. More Americans today are chronically ill.
We've still got 50% of the population in this country that have some kind of chronic disease that must be better managed than it is today.
More than half of Medicare recipients have 5 chronic diseases, multiple chronic diseases. This is where the cost is.
And the obesity epidemic is going to drive the healthcare costs through the roof. And if we don't do something now, it'll be too late.
The number of obese children and youth has tripled since 1980, and with it an onslaught of juvenile chronic conditions.
And so if we pay attention to the health of the young, we may be able to, in the long term, abate the tremendous increase in chronic diseases that manifest themselves when people age.
2. Many Americans receive a lot of care, but it's not necessarily the right care.
The McKinsey Institute comes out with a study every year that shows that close to 1/3 of all healthcare spending, $2.2 to $2.4 trillion a year, you can't show an enhancement of quality of care.
We should be incentivizing outcomes for patients, not treatment.
3. Wasteful and inefficient administration of our fragmented healthcare system creates excessive paperwork, redundant care, and increases in medical error.
Honestly, if we don't have access to the same data, if we're not able to see that a patient who moves from Missouri and moves right over to Kansas, we can't see what health care they got in Missouri. They don't remember what prescriptions were written for them. They don't remember the dosing of that, and we're not able to level that playing field for them, then we can't compete.
U.S. healthcare spending accounts for 16% of GDP today. Without modernizing the way we deliver healthcare, especially prevention and management of chronic disease, it is expected to rise to 25% of GDP by 2025. The message is clear. If we don't deal with the cost drivers now, 1 out of every $4 of our income will soon be spent on healthcare.